look in the mirror, not for vanity, but for clues. For centuries, before blood tests and scans, physicians read the body's surface like a map. Today, we'll learn a simple, visual audit you can do at home. How white nail spots, a coated tongue, or pale lower eyelids can point toward zinc shortfalls, gut overgrowth, or hidden anemia. This is not a substitute for professional diagnosis, but a practical way to notice signals your body sends. Start with the nails. Hold one hand up, palm away, and study the nail beds. Tiny white spots that appear sporadically after minor trauma are common and usually harmless. But when white patches multiply or a film covers large areas of several nails, take note. Persistent whitening or brittle nails can be associated with nutritional gaps, particularly zinc. Zinc is essential for cell division and repair, and nails grow slowly. Deficiency may first show there. Also look for ridges running horizontally, called Beau's lines. These can mark past stress or illness, but when combined with paler nail beds, they suggest systemic issues that deserve attention. Now tilt your head and examine the lower eyelids. Gently pull down a lower lid until the inner surface is visible. Ideally, it should be a healthy pink. If instead you see a pale, washed-out color, especially across several checks and different days, that can be an external hint toward low iron or anemia. The eyes and mucous membranes reflect blood oxygenation and hemoglobin levels. When these are low, tissues appear paler. Again, this is a visual cue, not a final answer. If you notice sustained paleness, it warrants a conversation with a clinician and, likely, a blood test. Move to the mouth and the tongue, one of the most telling surfaces. A clean, slightly pink tongue is a good baseline. If you observe a thick white coating covering most of the tongue, especially if it scrapes off leaving a red surface beneath, consider the possibility of an overgrowth of yeasts, commonly Candida. Gut microbial imbalance can manifest in the oral cavity because it's part of the digestive tract's interface with the world. A furred tongue accompanied by bad breath, bloating, or irregular bowel habits strengthens the suspicion of dysbiosis. A geographic tongue patchy, map-like red areas can indicate nutrient deficiencies or immune-related responses. Again, these are clues to guide follow-up, not definitive proof. Next, step back and look at skin quality and color. Dull, dry skin with flaky patches can correlate with essential fatty acid deficiency or zinc insufficiency. Zinc supports skin integrity and wound healing, so persistent erosions, slow healing cuts, or acne that resists treatment might deserve a nutritional review. Conversely, a yellowish tint to the skin and eyes could suggest liver-related issues or excess bilirubin. That's a different pathway entirely and should prompt medical evaluation. Combine observations for a clearer picture. For example, white nail changes plus brittle hair and delayed wound healing point more strongly to zinc shortfall than any single sign alone. Pale lower lids with fatigue and shortness of breath raise the suspicion of anemia more than pale lids in isolation. A thickly coated tongue paired with recurrent yeast infections or sugar cravings increases the likelihood of Candida-related imbalance. The pattern is what makes these visual audits meaningful. Finally, keep a simple checklist and repeat it over weeks. Photograph findings under consistent light and compare. Note associated symptoms: energy levels, digestion, skin changes, sleep. If multiple signs persist, seek laboratory confirmation iron studies, serum zinc, complete blood count, or stool and fungal assessments as appropriate. Visual inspection is about awareness and early detection, not definitive diagnosis. Close by, remembering the mirror is a tool. It gives immediate, inexpensive data that you control. Treat what you find as evidence to investigate thoughtfully. When you next stand before your reflection, look with curiosity. Your body keeps records of what it needs. Observing them carefully is a first step toward better health.